cancer diagnosis and your pathology report. Yep, here it is, guys. One big stack of my whole history here. And I want to read to you some of the things that are such an aha moment of why I started this. First of all, did you know that when you're diagnosed, they determine where the tumor is located like a clock of sorts? Left breast, 1 to 2 o'clock. That's where my lovely walnut-sized tumor was hanging out. And here are the terms that made me start Learn Look Locate, that made my head spin. Invasive ductal carcinoma. I did not know what that meant. Nottingham histological grade 1. I must tell you that I think even my nurse navigator wasn't sure what this meant, and I was determined to find out what grading meant. All I knew was staging. So according to my medical advisor, Dr. Hannah Gilmore, she's a pathologist, the grade actually represents the tumor's aggressive potential. Cancers that are rated with lower grades tend to be less aggressive. So when I saw grade 1 and put 2 and 2 together, I went to research this myself, I was a little relieved. I still needed to know more. Determining the stage and grade is very important because these factors are used to predict your prognosis and help direct your treatment options. So those that have a higher grade tend to be more aggressive, grade 2, grade 3. So I was a little relieved. However, there are so many more terms on here. Mitotic rate, score 1. I still don't know what that means. I'll be working on that. Measuring 1.2 centimeters in greatest continuous extent on slide. Have no clue what that means. Ductal carcinoma in situ, DCIS. Didn't know what that meant. Intermediate nuclear grade with focal necrosis and calcifications displaying solid and crib form patterns. Oh my God. There is so much in here, guys, that we just don't understand. And this is like a new college education because we are dealing with our life. So I'm going to be addressing our pathology report. I think it is so important that we truly understand what these terms mean. Yes, they're above my pay grade, but the biggest one here today that I want people to understand is grading. Because again, the higher the grade, the more aggressive the tumor is. And cancers that are rated with lower grades tend to be less aggressive. Sorry, I'm reading from my pathology page from Dr. Hannah Gilmore. She's a pathologist. I hope you find this helpful. Have you taken a deep dive, guys, into your pathology report? As you can tell, I'm quite obsessed with this, and I want people to be empowered and understand this because emotionally, there's just so much coming at us, and I think if we understand what this all means, for me, it calmed me down. I hope you find this helpful. Learn, Look, Locate, follow for more. Did you know this? Did you have any idea? And did you know some of the other terms that I brought up? I have no clue, and I'm still going to work on it and bring it to you. If you want more, look at the link in my bio, guys. So much more information from my incredible medical advisors.